This is a Mid-America PTTC podcast where we believe prevention is better together, and together we are stronger. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 39. I had the pleasure of speaking with Mike Parsons, who is a prevention program coordinator at Kansas's very own Developing Caring Communities Committed to Action, also known as DECA. Now, Mike shares the great work they're doing across the state with their Drug Endangered Children Alliances and the amazing lineup of speakers for DEC Awareness Day, and actually the entire month of April. But before we get into the content, we'd like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
All right. I would like to welcome Mike to the podcast. Mike, thanks for joining us.
No problem. Thank you, Dave. Thanks for having us.
All right. So for you listeners, Mike works at a place called DECA. I'm very familiar with it, but hey, for our audience, could you kind of unpack what DECA is?
DECA is an agency located in Kansas. We're based out of Lawrence, Kansas. We started back in 1974. It used to be the Douglas County Citizens Committee on Alcoholism, and we mainly focus just on alcohol treatment. But over these last several years, 30 some years now, we've just broadened out, and now it's what stands for is Developing Caring Communities Committed to Action, or as we like to say, #improving lives. So we have a variety of different programs now. One of them is prevention, drug and alcohol prevention, suicide prevention, things like that. We also have programs like child safety. Our main focus is mainly treatment. So we have inpatient facilities and outpatient facilities. We have men's treatment facilities, women's treatment facilities. And one of the rare things about our agency is we actually have two facilities that offer daycare. The moms can bring their children to treatment, and the children go to daycare during the day, but still live with their parents during the night. And it's really nice benefit to have where they don't lose their children into the system if they decide to go into treatment. So, but like I said, I work with the prevention area, and I'm a program coordinator for the prevention program of DECA.
What does program coordinator entail?
Well, it mainly entails supervising what we call community support specialists. And I also involved in a lot of training, a lot of different programs that DECA has. But we currently have our state divided up into 5 different territories. And then we have one of these, what we call community support specialists, or CSS, in like the Northwest, the Southwest, the central part of the state, and then we have Northeast and Southwest, or Southeast corner. And they work with coalitions, funded and unfunded coalitions, and any type of group or alliance that's working on something to help in the area of preventing, drug and alcohol, suicide, any of those topics we mentioned before, in preventing those and making lives better.
Absolutely. And I'll tell you what, those community support specialists are awesome.
Now that COVID is lessening its hold on us, we're getting back out there, and we're covering these 105 counties the best we can.
You guys are doing great work. Keep it up.
Thank you, sir.
I want to do a little walk down memory lane for our listeners and talk about what brought us together. And I kind of want to start out first by reminding folks that for our PTTC region, our priority area is drug endangered children. And a quick snapshot of that definition: the National Alliance for Drug Endangered Children defines drug endangered children as children who are at risk of suffering physical or emotional harm as a result of legal or illegal drug use, possession, manufacturing, cultivation, or distribution. They may also be children whose caretakers' legal or illegal substance misuse interferes with their ability to parent and provide a safe, nurturing environment. So that's a quick snapshot at the definition of a drug endangered child. And you'll hear us saying DEC throughout, and that's what we're referring to. So since that's our priority area, we have been doing local core DEC awareness trainings, and that's what brought us to Kansas, where we got to meet the amazing crew at DECA. You know, those folks that are developing caring communities committed to action. # improving lives.
No, Dave, you just brought up a good point. That takes us back to, I want to say about a year and a half ago.
Yes.
Maybe two, but we've got a lot done in Kansas since you and I crossed paths. Because the first time I experienced you guys or ran into quote DEC was at a training that National DEC put on for the state of Kansas in order to the main purpose of it was to get new alliances started across the state in the different counties that we have in order to protect these kids.
Yes, absolutely. And a part of the power of sort of that DEC approach is to build a network of local level, community-based, county-based DEC alliances, really focusing on identifying these children and creating and connecting them to the support and services that they and their family members need. But at that first training that you mentioned, we had a little brainstorm session afterwards that kind of created something that really solidified this great partnership. Want to unpack what that is for us?
Yeah, it's the DEC Academy. It basically, like you said, was just kind of a brainstorm discussion idea. A lot of what if this, what if that, and then if I remember correctly, it kind of fell by the wayside until you and I crossed paths again about a year ago down at I believe it's the Missouri Prevention Conference. And we talked a little bit more about it, and with little further discussion, we went ahead and kind of came up with the actual layout and design of, I think it was the first ever DEC Academy for the state of Kansas.
Yes, first ever DEC Academy in the country. Some big things came out of that as well. So quick snapshot of that. We identified 7 different counties, and there were teams. So 2 to 3 folks from each county that were motivated and driven and really wanted to change the trajectory of drug endangered children's lives. And over a 6-month period, we walked them through the process on how to get their own local alliance up and running and how to best serve the drug endangered children in their counties. And let's just take a little pause real quick. You want to give us some shout out to those counties as well? Yeah.
Well, sure. And I just want to point out, if you remember this, originally our design was to do this face to face with maybe a few virtual meetings. But then when COVID hit, we had to quickly revamp the entire program, and you guys did a great job of turning it all over. So we did the entire academy, virtually. So we have to shout out, the 7 counties that we originally came up with that volunteered were not only some of our, what we call our frontier or rural counties that are the very small populated ones in Kansas, but also some of our larger ones, like where our headquarters is at, which is Douglas County. And that's where, for those of you not familiar with Douglas County, that's where the University of Kansas or the KU Jayhawks are at. So that's very close to the Kansas City area. But we have a Cherokee, Montgomery, Elk, Coffee, Barton, Douglas, which I mentioned, and Pratt were the first 7 counties that joined the academy. And since then, we've got the one in Sedgwick, which is Wichita County, a very large area. We're kind of refiring their DEC Alliance back up, and we've also have interest in Butler County right now. And then just this week, I was talking to the county attorney down in the Reno County area, and they're looking at getting their alliance started back up down in the Hutchinson, Kansas area.
Look at that just wave of DEC awareness, DEC movement across the state of Kansas. That just fires me up right there. Y'all are doing amazing things. Now, I understand you had a pretty cool meeting with the Shawnee County DEC Alliance, which is, if I'm not mistaken, the longest running DEC Alliance in Kansas.
Right. It's our most, I don't want to say productive, because they're all productive, but it's our longest functioning, put together alliance in the state of Kansas. And they've been around for many, many years now. And that's I sit in on all the DEC Alliance meetings across the state. But I was sitting in on this one probably about a month ago, and we started talking about National DEC Awareness Day, which is April 28th. And so from that, just like the brainstorming session we had, you and I was talking with Jennifer and Christy, who lead that alliance, and said, why are we just planning something for one day? Why don't we go bigger and maybe try to do something for the entire month? Because I didn't know of any other states that were doing a lot of things to promote National DEC Awareness Day. And we discussed a little more and thought, what about an activity each Wednesday, prior to that Wednesday of April 28th? And they kind of shook their head and said, it sounds like a good idea, but if you want to run with it, you run with it and you take it. So we went ahead and took it, and we've got quite the month planned.
Yes, you do. Yes, you do. And I love how the crew there at DECA, y'all dream big, but you also followed up with working big too. Y'all make things happen. Quick little background on DEC Awareness Day. National DEC and its network of state, tribal, and local DEC alliances, along with other professionals across the nation, they've designated that fourth Wednesday of April for focusing on drug endangered children awareness. On this day, individuals, agencies, the multidisciplines that are involved in the DEC approach all come together to share that common vision and provide awareness on what issues and risks drug endangered children face, and what can be done to identify, protect, and help these children. And do y'all have a lineup of some pretty cool events to really raise awareness? I don't have it memorized, but hey, what all you got going on?
Yeah, we're real excited about it, Dave. We started what we call small, or what's happening in Kansas, because we primarily focus on Kansas, but we're also, broadening and letting this out nationally, because anyone across the nation is invited to join us as we go through this. But our first one on April 7th is going to be focused more on Kansas and kind of our stats and facts and what's going on here, and talking about the different alliances, and really to get interest started on, how can we get more alliances across the state. I need to back up just a second, because our state conference is March 30th and 31st. And so we thought, with the interest and momentum we have there, let's just keep it rolling through the month of April. And we've got a lot of interest in it so far. We're excited to keep going. Then on the 14th, we've got Dr. Carrie Weeks. She's an associate professor at the hospital chains or divisions down in Wichita, and she's connected to KU, but she's the director of Child Abuse and Neglect Division, Department of Pediatrics. So she's going to be talking to us about what they're seeing down in their hospitals in the Wichita area. Talk to us about, not only the drugs that they're seeing, but also the effects that they're seeing, and kind of share some non-identifiable stories, just to kind of, show us the impact of that. I believe she's going to focus on, although alcohol and marijuana are very popular, she's going to focus a little bit more on opioids, and then also methamphetamine, because we still have a huge methamphetamine program or problem in the state of Kansas. So we're very excited to have her. She'll be, and all these I should mention are going to be presented live on not only through Zoom, but also through Facebook. And they're from 10 to 11 a.m. Central Time on each one of these Wednesdays. On Wednesday, April 21st, we've been lucky enough to have folks from the Montana Institute that are going to be joining us. And they're going to be talking about how balancing ACEs with hope, which are health outcomes of positive experiences, and really going to focus on the resiliency of children and even children that we come across in these situations, on how they can really bounce back and still be creative, positive, and kind of turn the cycle of things that we're seeing, that there's still good chances and opportunities for these kids. And then on Wednesday, the 28th, which is the actual National DEC Awareness Day, we're going to have the folks from National DEC join us, and they're going to kind of present on what's happening nationally. They're going to talk about their vision and their mission statements. We're going to talk about, what other alliances are doing across the United States, what people may have kind of a question answer. And I believe they're going to talk about the new app, which you may know a little bit more about, the new app that they've designed that you can download on your phone that will help with DEC efforts, in your community across your states.
Yes. Yes, they have been teasing the smartphone app that they've been developing for quite some time now. And actually, they just got some great media coverage as well. And rather than me try to butcher the explanation, I'll drop a link in the show notes for all of that
Great.
media coverage as well.
Great.
Whoo! Yeah, so every Wednesday, the month of April, 10 a.m. Central Time, y'all can join and learn about what's going on with DEC in Kansas and some more in-depth training throughout that month. I'll drop the links in the show notes. You can watch along in Zoom or even on Facebook. Whoo, y'all got a lot going on.
Yes, we do, but we're ready to get started. We're really looking forward to it.
Mm-hmm.
And so far, the response has been fantastic. So we've got all sorts of agencies, not just DEC alliances, but all sorts of agencies that help children across the state, very interested in learning more about this topic.
Absolutely. And hey, you guys definitely right in line with what we believe at the Mid-America PTTC, that prevention is better together, and together we are stronger.
That's right.
Yeah.
Thank you very much, Dave.
Yes, indeed. All right. Well, hey, I think that covers it for this podcast episode. Y'all listening, thanks for tuning in. There'll be a lot of links in the show notes here where you can find out how to register for these events and also more information around National Alliance for Drug Endangered Children. Mike, thanks for being here. And hey, thanks for being who you are and doing what you do.
No problem. Thank you, Dave. And thanks for all that you do for us also, because we couldn't do this without you guys.
Prevention is better together.
That's right.
All right. Take care, y'all. That concludes this episode. Thank you all for not only taking time to listen, but your continued work to make our region safe, healthy, and drug-free. If you'd like to know what training we have coming up, check out our website at pttcnetwork.org. And remember, prevention is better together, and together we are stronger.